Dentists regularly, but unintentionally, decrease the value of the dentistry they do. If your patients are objecting to the cost of your dental work, you need to help them understand the value that you provide and that they're getting more than their money's worth. For today's Throwback Thursday, I want to revisit a podcast from early 2014, one that will tell you how to get rid of price objection once and for all. Enjoy. Colin, receiver here again. Today's Tuesday, February 25th, and I want to ask you a question today. If I could give you all the dental patients you want for the rest of your career, would you give me $5 million today up front? Most of you would probably say, no, the price is too high. But I'm going to tell you why price actually isn't the issue with that question. Stay tuned. So can I deliver every patient you'll ever want for the rest of your career for $5 million up front? How's that sound to you? If you're like most dentists out there, it probably doesn't sound very good. There's probably a number of questions going through your mind like, first off, do I have $5 million to raise? For a lot of you, you could probably come up with it if you needed it. And the second question is one of value. Can Colin actually deliver on all those patients over the next 10, 20, 30 years of your practice? And what's your return on investment really going to be? Would you recoup that investment? But your objection isn't really to paying the $5 million. I mean, let's look at this in contrast. If the $5 million was for, say, world peace, or for, say, a loved one to get a transplant or an operation that they needed, we could all probably come up with it. So for most of us, the money is not really the problem. The issue at hand here is value. Is $5 million up front going to equate into a substantial ROI down the road? And this is the same kind of proposition that you're making to your patients when they come in and they need $25 or $40 or $75,000 worth of dental work. For some patients that you present to, any amount of money, you might as well tell them that they're going to be a man on the moon in the future, because they're simply not your target patients. They're not interested in the type of dentistry that you provide. Patients see this same proposition too when you're presenting treatment to them. And for some patients, whether it's 10 or 25 or 50 or $100,000 case presentation, it might as well be $1 billion, because these simply aren't your target patients. There's other patients that you could present to them for 50 or 100,000, and it really wouldn't matter what price tag you put on it. They're going to accept that case either way. There's a few things to remember with price framing with case acceptance. And the first is, remember, don't put the price right up front. There's a thing called sticker shock. And when you show them the price before you show them what you're delivering, you're already mentally in their mind running them off. The next thing you want to do is emphasize what you're going to do, the value of what you're going to do, and also give them a couple different options. A lot of times when a patient comes in, you may know their problem, but you don't know if they want the Honda or the Cadillac or the Ferrari. With case presentations for maybe implants, say they come in and they're tired of their dentures. They might be a patient that wants a couple implants on their lower to stabilize that. And you can, put a couple locators in their denture and send them on their way. They may be a patient that wants to put a few implants in and have a fixed lower, and send them on their way, have them come back in 6 months and permanently attach their new teeth. Or they may want the Ferrari, and they may want you to do, say, an all-on-4 if they qualify, and do immediate loading and send them out that same day with their brand new teeth. The interesting thing with price framing is you can only downsell. You can't upsell. And if you've ever walked into Best Buy to buy a TV, you've probably run across this. The salesman comes out on the floor, and when you tell him you're looking for a TV, he'll ask you a few questions, and then he's immediately going to show you a TV that is 50% above the price range that you gave him. Or if you haven't given him a price range, he's probably going to start you with the most expensive TV on the floor. And you're going to buy that, or you're going to say, well, that's too much money. And then he's going to show you the next price down, the next step down. Maybe instead of that 70 inch, he shows you the 60 inch next. And what's interesting about consumer mentality with pricing is once you have committed in your mind that yes, that 50-inch TV for $1,000 is what I want, it's very difficult for them to upsell you on a 60-inch for another $500. Mentally, once a person has identified that product they want and the price point, you're never going to upsell them. But if you start with a higher price product, it is very easily to downsell them if the only objection to it is that it's at a higher price. If they still want the product you're offering, they just wanted it at a lower price, it's very easy to move them down the chain. You offer that all-on-4 at $25,000 a jaw. If they don't like that, offer them the fixed lower for $15,000. If they don't like that, then offer them to retrofit their lower denture with a couple locators and implants at $7,500. And they go, that's what I want. And you're sold. Remember throughout your case presentation to remind them of where they're at now. The best way I've heard it described is by a guy named Sean D'Souza. And if you've never checked him out, Google his name and look at what he does with talking about mentality of your customers. You want to be like a roller coaster in your customer's mind. And as you take them up the roller coaster of pain, you identify and remind them of the pain they're having, and then let them come back down and remind them of some of the benefits and how good it's going to feel. But then they got to go back up the roller coaster. If you let your sales presentation flatline and you don't continually remind them of where they're at now and the pain that they're having and what's going to happen if they don't make a choice, well, hey Susie, it's going to keep continuing to bother you. You're still not going to be able to chew. Remember that date you went on where your denture popped out? That's going to happen again. You don't want that to happen again, do you? Now, tactfully working that in and reminding them of why they came into the first place. Why are they sitting in front of you in the first place? They've got a pain or a problem. And subtly working that in and keeping that at the top of their mind is going to give you a better close on more of the bigger elective cases. Sometimes people don't act in their own self-interest, especially after you've been talking to them and they've got complex numbers and options going on in their head. So if you're still wondering how to attract all of the patients you want, send me a check for $5 million and I'll get back to you.